We're back with the second part of our physical assessment. I left off at the nose and the mouth. I will be doing the neck, and I will check the skin. Skin is normal for patients' ethnicity. No mass lesions or scars. I will be assessing the patient's carotid artery on both sides. I will also be assessing the patient's JVD, if I can get you to lean your head to the side, which is the vein that pops out right about here. And I will also be assessing the patient's range of motion. Can I get you to turn your head to this side, facing my pen, and turn your head to this side, facing my pen? Thank you. Next, I will be assessing the upper extremities. I will be checking the skin once again for any mass lesions or scarring. I will be checking hair distribution, which is even. And I will also be assessing the patient's range of motion. Can you lift your shoulders up to my hand? Okay. And can you do that? Can I see your elbows? Lift your elbows, bend your elbows, flex your elbows, and extend. Great job. Can you push up against my hands? Can you push back against my hands? And how about with your forearms? Can you push down? Can you push up? Okay. And can I see your hands? Can you push towards my hand? Okay. And push away from my hand. Up. And can you squeeze my hands? Great job. And can I see your fingers? Okay. Next I'll be assessing. I did that. Next I'll be assessing the patient's chest. Checking the skin once again for any scarring, mass, or lesions. And then I'll be assessing the patient's respiration movements on both sides to see if they're symmetrical. Next, I'll be auscultating, listening for respirations first. I will listen for respirations, and then I will listen for the heart. Well, first, I'll start with respirations. I'm going to check posterior and lateral breath sounds. I'm just going to turn the chair so that I'm going to get you to lean forward from me. Can you sit up? And can you take a deep breath? Another one. That is posterior. I'll be checking lateral, and I will check 18 fields, 26 fields of respiration, but we don't have that time. So this is lateral. Can you breathe? Take a deep breath from me. Okay. And next I'll be checking anterior respiration sounds, breath sounds. Can you take a deep breath from me? Okay. Oh, I need to turn you back around too. Next I'll be checking heart sounds. Okay. You can just relax. I'm just checking your heart sounds. We're checking for your heartbeat. Okay. Rate, rhythm, and amplitude was even in rough sounds, and also in the heart sounds, I checked the apartment M on heart sounds. And next I'll be doing the back of the stethoscope, checking for beats and murmurs. Stop doing that. Okay. No buttes or murmurs noted. Next, I'll be assessing the patient's abdomen. I'm gonna just lift your shirt up a little bit. Is that okay with you? Okay. I'll be assessing for any scars, lesions. I'll be checking the contour for symmetry. No scars, lesions, mass noted. Skin is normal for a patient's ethnicity. Hair distribution is even. The umbilicus is midline. And next I'll be auscultating the patient's 4 quadrants, checking for any vowel sounds. And I will start with the upper right quadrant. Okay. Next, I'll be assessing vowel sounds noted. Vowel sounds can be active, hyperactive or hypoactive, and absent. If absent, I will check all 4 quadrants for 5 minutes, 30 minutes altogether. And next, I'll be checking the patient's eating habits.
No, I mean, yes.
Can you tell me a little bit about your eating habits? What do you eat?
Fruit, vegetables, protein, and lots of water.
Okay, great job. And can you tell me about your intake and outtake? That means you going to the bathroom. Well, you tell me about your intake. Can you tell me about your outtake? Going to the bathroom, your urine and your bowels.
Yes.
Normal.
Normal.
Okay. And and next I'll be doing a lower extremity assessment. And in this assessment, I will be checking the patient's skin for mass lesions, scarring, and edemas. I will be assessing the patient's range of motion and checking the popliteal, the tibula, and the dorsalis. Ooh, almost forgot that. Okay. Can you lift your legs up for me against my hand? Can you push them down against my hand? Forward, push, back, push. Okay, can you plantarflex? Can you dorsiflex and plantarflex? Push forward and down, okay. And next I'll be checking the popliteal, which is behind the knees, in a symmetrical form, checking both. I'll be checking the tibula on both. I'll be checking the dorsalis pulse, and I will be inspecting the patient's, I knew I won't be able to see, that's why I tried to tell him. I'll be checking the patient's toes. You can put your sock back on, I'm sorry about that. And I've already checked the patient. Go ahead. I've already checked the patient's gait. And in the finalizing this assessment, I would have made sure that I provided therapeutic communication and stayed modest with the patient's wishes to stay covered. Okay, and that's the end of this one.